Hi, my name is Dr. Regador III. Thank you for spending your time with this lecture. Welcome to our discussion on renal dietetics. Today, we'll explore dietary strategies essential for managing kidney health. The goals of nutritional care in renal disease include preventing malnutrition, minimizing uremic toxicity, and managing metabolic disorders. It's crucial to maintain nutritional status with adequate protein, calories, vitamins, and minerals, while ensuring the diet remains palatable and enjoyable for the patient. Assessing nutritional status in renal patients involves analyzing anthropometry data. This includes comparing height and weight to norms, calculating body mass index, determining ideal body weight, and monitoring weight changes. These metrics help tailor nutritional interventions effectively. This slide shows how to get the body mass index. The scale is found on the chart. The person needs to check his weight and height and calculate using the BMI formula. The BMI weight status table categorizes individuals based on their body mass index. A body mass index below 18.5 indicates underweight, 18.5 to 24.9 is normal, 25 to 29.9 is overweight, and 30 or above is classified as obese. These categories help assess health risks associated with different weight ranges. Let's examine the biochemistry data. This includes the blood sugar profile, renal profile, liver function tests, lipid profile, uric acid levels, and electrolytes. These parameters are crucial for assessing metabolic and organ function, providing insights into overall health status. Clinical examination involves assessing loss of appetite or weight, fluid status, and general conditions like lethargy and weakness. Monitor intake and output, bowel movements, and gastric residuals for comprehensive health history. Assess dietary intake by obtaining a 24-hour recall. Use a checklist to evaluate consumption of sweetened, salty, high-fat, high cholesterol, high potassium, and high phosphate foods. Identify any food allergies or taboos. Determine the mode of intake, whether tube, oral, or total parenteral nutrition. Evaluate the living situation to ensure adequate facilities for food preparation. Assess the financial situation and behavior for signs of depression or lack of interest in food. Compile this data to make an informed diagnosis. Sodium intake should be restricted in patients with renal disease experiencing fluid retention or hypertension. Sodium is naturally present in foods and often added during processing. The primary source is table salt or sodium chloride. Regularly assess blood pressure, edema, serum sodium levels, and dietary intake. Limit sodium for patients with minimal urine output, hypertension, and edema to manage renal disease effectively. To maintain a low sodium diet, avoid high sodium foods like soy sauce, barbecue sauce, and processed foods. Opt for fresh options such as fruits, vegetables, and fresh fish or meat instead of preserved products. Enhance food flavor with spices, herbs, lemon juice, or vinegar. Eating at home allows better control over salt intake. When cooking for family, set aside your portion before adding salt. Use salt substitutes cautiously as they contain potassium chloride. Fluid retention can cause ankle swelling, shortness of breath, weight gain, and increased blood pressure. To manage these symptoms, reduce sodium intake, which helps decrease thirst and fluid consumption. To control fluid intake, measure daily water in a container, allowing 500 milliliters plus previous urine output. Sip drinks, take medication with meals. Suck on small ice cubes, and rinse your mouth regularly. Renal patients face an increased risk of heart disease. It's crucial to maintain a healthy lifestyle by consuming nutritious foods and avoiding fatty foods. This approach supports overall health and reduces cardiovascular risks. Potassium is a mineral found in most foods. For those with high serum potassium levels, intake should be restricted to 2 to 3 grams daily. Avoid syrup in canned fruits and raw dark green vegetables. Instead, soak vegetables in water for 1.5 hours before cooking and discard the water. Avoid dried, baked, or crispy potatoes, yam and tapioca. Cut them into small pieces before boiling. Limit foods cooked with chili or curry powder to 2 to 3 times a week. Restrict coffee or tea to 1 cup daily, avoiding thick brews. Hyperkalemia often requires potassium restriction and avoiding potassium chloride salt substitutes. For hypokalemia, especially in peritoneal dialysis patients, it's crucial to monitor dietary intake and serum potassium levels. Normal potassium intake is 3 to 4 grams daily, while low intake is 2 to 3 grams. Let's explore the potassium content in fruits. Low potassium options include watermelon and apple. Moderate sources are mango and papaya. High potassium fruits include banana and avocado. Understanding these levels helps in managing dietary potassium intake effectively. Let's explore the potassium content in vegetables. Low potassium options include French beans and pumpkin. Moderate levels are found in kale and long beans. High potassium vegetables include carrot, tomato, and lady's finger. Understanding these levels helps in dietary planning and managing potassium intake effectively. Fruits should be consumed in limited amounts, peeled and soaked when possible. Canned fruits must be drained before eating. Avoid boiled daun soup, patay belalang, ginseng, Chinese roots, jamu, nuts, chicken essence, cola drinks, and cocoa. When kidneys fail, phosphate levels rise, leading to bone disease, joint pain, skin itchiness, and eye irritation. Control is achieved through a low phosphate diet and phosphate binders. Patients with chronic renal failure, hemodialysis, and continuous ambulatory peritoneal dialysis require 800 to 1200 milligrams per day. High levels may result from excess protein, dairy intake, or inadequate dialysis. Let's examine the phosphate content in various foods. For instance, a bowl of mee rebus contains 365 milligrams, while a standard serving of chicken rice has 467 milligrams. In contrast, soya bean milk has only 41 milligrams. Understanding these values helps in managing dietary phosphate intake effectively. A low phosphate diet is crucial. Avoid foods high in phosphorus like egg yolk, chocolate, and nuts. Fish and shellfish should be consumed without bones or shells. Limit protein-rich foods and avoid bone marrow. Use phosphate binders with meals, ensuring tablets are chewed or crushed with food. Aim for a low phosphate diet. Foods high in protein, like milk products, often contain both calcium and phosphorus. It's crucial to bind phosphate and reduce intake to less than 800 milligrams. Patients with higher protein needs may have increased phosphate intake. Dialysis patients often need increased vitamin D due to deficiency. Calcium requirements are 1200 milligrams per day. Hypercalcemia risks include calcium-based phosphate binders, tertiary hyperparathyroidism, and bone disease. Key calcium sources are milk, cheese, sardines, nuts, and ikan bilis, which are also high in phosphate. Vitamin D deficiency in dialysis patients can result from poor dietary intake, loss through dialysate, and absorption interference due to drugs or uremia. Addressing these factors is crucial for patient health. In cases of kidney failure, erythropoietin EPO production is impaired, necessitating synthetic erythropoietin administration to manage end-stage renal disease anemia. A high iron diet, including liver, kidney, red meat, beans, nuts, dried fruits, and oysters, is recommended. However, due to high phosphate content, caution is advised. In chronic renal failure, energy intake should match that of healthy individuals. For those under 60, aim for 35 kilocalories per kilogram of body weight. For those over 60, target 30 to 35 kilocalories per kilogram. Protein restriction aims to delay dialysis and alleviate uremia symptoms. It's crucial to tailor each patient's diet to their specific needs. Protein restriction is crucial when the glomerular filtration rate is between 20 and 30 millilesmin with intake at 0.8 to 1.0 grams per kilogram ideal body weight. If below 20 millilesmin, reduce to 0.6 to 0.8 grams per kilogram ideal body weight. Maintain this until dialysis starts, ensuring 60–70% of protein is from high biological value sources. For a patient weighing 50 kg, protein intake should be 40 grams per day. This includes 24 grams from high biological value, HBV protein, and 16 grams from low biological value, LBV protein. For ESRD non-dialysis patients, energy intake should match energy expenditure similar to healthy individuals. Those under 60 should aim for 35 kilocalories per kilogram, while those over 60 should target 30 to 35 kilocalories per kilogram. Protein intake should be managed to reduce nitrogenous waste generation. A low protein diet, specifically 0.6 grams per kilogram of body weight, is recommended for effective management. For a patient weighing 50 kg, the recommended protein intake is 30 grams per day. This includes 18 grams of high biological value, HBV, protein, and 12 grams of low biological value, LBV, protein. HBV protein, or high biological value protein, contains all essential amino acids in the right proportions. It is crucial for maintaining muscle mass and supporting overall health. Common sources include meat, fish, eggs, and dairy products. Low biological value proteins or low biological value proteins are typically plant-based and lack one or more essential amino acids. They are often combined with other protein sources to ensure a complete amino acid profile, crucial for maintaining health and supporting bodily functions. Dialysis enhances glucose metabolism, potentially reducing insulin needs for diabetic patients on dialysis days. Improved tissue sensitivity to insulin means patients should lower insulin intake and eat before dialysis. Adhering to a dietitian's guidance is crucial for maximizing hemodialysis benefits. Supplying adequate calories is crucial to reduce protein breakdown for gluconeogenesis. Vegetable oils such as olive, canola, and sunflower are excellent calorie sources without affecting cholesterol levels. Additionally, hard candy, sugar, honey, jam, and jelly offer calories and energy. Dialysis improves the abnormalities of glucose metabolism. The insulin requirement of diabetic patients may be reduced on dialysis days due to improvement of the tissue sensitivity to insulin. Patients should reduce their insulin intake on dialysis days and eat before dialysis. Patients should follow the dietitian's advice closely to get the most from the hemodialysis treatments. Low body weight is linked to higher mortality rates. For those under 60, aim for 35 kilocalories per kilogram body weight, and for those over 60, 35 kilocalories per kilogram. Focus on complex carbohydrates to prevent frequent glycemic peaks. Maintaining an adequate nitrogen balance is crucial for dialysis patients. There's a significant link between serum albumin levels and mortality. During hemodialysis, patients lose 1.5 to 3 grams of amino acids per hour, with losses increasing when glucose-free dialysate is used. The recommended daily protein intake for dialysis patients is 1.1 to 1.2 grams per kilogram of body weight. At least 50% should come from animal sources. For example, a 50 kilogram patient should consume 60 grams of protein daily, with 36 grams being high biological value, HBV, and 24 grams low biological value, LBV. A dietitian will guide patients on daily fluid intake. Excess fluid can elevate blood pressure and strain the heart. Be mindful that foods like soup, ice cream, and fruits are high in water content. Potassium is crucial but can be dangerous if consumed excessively, affecting heartbeats. It's abundant in fruits and vegetables. To manage potassium levels, avoid foods like oranges, bananas, and tomatoes. Peel and soak vegetables in water for hours before cooking in fresh water to reduce potassium content. Phosphorus, a vital mineral, can weaken bones and cause skin itching if consumed excessively. Managing phosphorus intake is crucial, potentially more so than calcium, in preventing bone disease and related complications. A good renal diet keeps the renal doctors and specialists away for a while, so take good care of your kidneys. These are your references. I hope you enjoyed the lecture. Thank you, and see you on the next topics.